This episode is made possible by my friends at Antech Diagnostics. Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great one for you today. I am really on a roll recently, talking about the future and innovation and where vet medicine is going with really interesting people. I am here today with Dr. Jimmy Barr, and you'll hear me gush at him when we start. He is a cool guy. He is a criticalist by training. He was the chief medical officer at Blue Pearl, which is the specialty hospital group. And now he is the chief medical officer at Antech Diagnostics. And so I'm talking to him today about where are diagnostics going? What is he excited about in the next 5 years? And it's one of those sort of mind-stretching conversations. It's really cool. So anyway, I was thrilled to have him here. We get into it. We start talking about spectrum of care and diagnostics and how do we meet people where they are as far as availability, affordability, what they want to do with their pets, and then also push to keep the standard of care that we have high. And so anyway, I talked to him about what he knows now as the chief medical officer at Antech that he wishes he knew back when he was a criticalist at Blue Pearl. And so anyway, lots of stuff like that. It is a fantastic episode. Gang, without further ado, let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Jimmy Barr. How are you, my friend?
Super fantastic. Thanks for having me.
Man, it is an absolute pleasure to have you. You are such an interesting guy. You have, for those who don't know you, you have a mouthful of a title. And so I'm going to tell you the short version of your title that most people kind of know would be Chief Medical Officer at Antech Diagnostics. Your official title is Chief Medical Officer for Mars Pet Care's Science and Diagnostics Division. And so you're both of those things. Just real quick, tell me real quick about so obviously Antech is a piece of Mars along with Banfield and Blue Pearl and VCA. And then across the pond, there's Anacura. This is a huge ecosystem. How do you fit into that? Antech is a piece of it and you are the chief medical officer there, but you also have this global footprint. What is that like?
First of all, thanks for having me here, Andy. This is always a big pleasure. I'm a huge fan. So it's great to be here and to talk with you today. Just to answer your question, Antech is a part of the Mars Science and Diagnostics Division. So do you think about Mars Pet Care, which is the largest division in Mars, truthfully?
Yeah.
It has Mars Veterinary Health. It also has Roark, and then Pet Nutrition is another. Those are all divisions. Mars Veterinary Health is where Blue Pearl and Banfield and VCA and the overseas the European group that you mentioned. And then there's the Science and Diagnostics Division, and it also includes the Waltham Pet Care Science Institute in the UK. And so, fortunately, I get to work with all those fantastic folks and, kind of get to be in the catbird seat for a lot of things that are happening.
That's amazing. So you, early in your career, you were on the faculty. So you are a criticalist by training. Let me start with that.
Yeah,
so you were not a pathologist, you were a criticalist.
Yes, right.
And you were on the faculty at Texas A&M, and then you went to Blue Pearl in 2007. In 2018, you're the chief medical officer at Blue Pearl, which is specialty hospital. So, and then you made the switch over to this.
Yeah.
In my eyes and in my mind, you've always been you're an emergency guy. You're a criticalist. You're a case seeing guy, and now you're the chief medical officer over at a diagnostics company.
Yeah.
What was that? What was the draw for you to sort of make that shift? What you do now is very different from overseeing specialty hospitals. What was that?
Yeah, big time.
Yeah, you to do that?
And we could even back up a little bit before that, Andy. I was a general practitioner when I came out of vet school.
I didn't know that.
Yeah. So I was a general practitioner for a few years, and then went and did residency at Angel in Boston, and then private specialty practice and, in Tampa, and then on faculty at Texas A&M. And then most of my leadership career was spent with Blue Pearl. And you're right. I'm a pretty clinically focused person, honestly.
Yeah.
Like we were talking about earlier, I love a good shock resuscitation. So I have to admit, I miss that part of clinics a little bit. But what had me make the shift to leadership is more about, impact and, helping this profession and being able to sort of have some influence outside of what I can do with clinical practice. And I have to be honest, like my leadership style and kind of how I approach things is all clinical. I mean,
Yeah.
I think about clinical science and differential diagnosis anytime I'm approaching any problem. And I'd be honest, it's been very helpful in approaching a bunch of different scenarios.
It's one of the reasons I was really excited to talk with you, right? Because you've got this very clinical mindset. You've been in the trenches. You know what it's like to push cases through. And now you're overseeing Antech in a lot of ways. And so that practicality of perspective is something I think is really exciting. And so I wanted to get into a couple of things with you today.
Sure.
I'm looking at vet medicine. It is changing rapidly in a lot of different ways. I'm seeing huge innovation in the pharmaceutical landscape, right? We are seeing monoclonal antibody drugs. There's just the last couple of years, we have seen absolute game changer medications coming out. I mean, just stuff that's getting used all the time that's really changing how we practice. And it just feels like this incredible time of innovation in the pharmaceutical land. And then in the exam room, I was in the clinic earlier today, and I'm using an AI scribe, and I love it. I mean, I think this is a huge deal. It's making our appointments faster. It's streamlining how we communicate with pet owners. My medical records have improved. They're getting these beautiful emails from me. Like just all of these things. My appointments are shorter. So I'm a huge fan of AI in the exam room and how it's making me a more engaged, focused, tuned in clinician that has better records than he ever did before. And so then I look around and, I feel like the PIM systems are jumping forward, leaps and bounds, big innovation. And diagnostics is kind of a black box to me, I think in some ways, right? I have no doubt that we're seeing significant innovation in diagnostics. Let me start at a high level with you and sort of say, hearing what I'm saying about just innovation across the board, convince me that diagnostics are keeping up with the other segments in terms of innovation. What are you excited about there?
There's a lot there.
There's a lot
honest.
there.
Yeah. I mean, when you think about diagnostics, it's an enormous part of what we do as veterinarians every day. I mean, and I think that when you take a step back and say, what's that for? It's to give us the data to help us make decisions, right? That the only thing that it does is take that relationship between a veterinarian and a pet and a technician and the client, give you data to kind of make decisions in that scenario. And anything that's created when it comes to diagnostics has to be supportive of that relationship and to be practical. There's all kinds of things that we could do, that we could use some of these new innovations, new technologies in different areas. But if it doesn't help you do your job from a day-to-day basis, and it doesn't give you extra information, then it's really not, it's not worth doing, right? And so whatever we're thinking about, how do we, move the needle forward in diagnostics, it's with that in mind, I guess is the point. Innovation doesn't have to be fancy. It doesn't have to be something where it is the newest application of a technology. It can be the application of an older technology in a more accessible way, or it could be so there's a little bit less expensive in some circumstances, right? There's all kinds of things in which we could do. Now, I'm here to tell you that some of the cutting edge stuff that is happening right now in veterinary medicine is exciting. I think you keyed on it a second ago. I mean, this is an exciting time to practice. I mean, there's just a lot of really interesting things. The amount of information that's within our grasp in a very short period of time is actually it's remarkable. I feel like that we're living in the future. I mean, there's just so many things that are sort of coming, that are happening now that we're able to use now. But in the next 5 years, it's going to be pretty amazing.
I want to ask you sort of your perspective here. I'm going to swing back around a little bit more, maybe into some innovations you're fired up about. I really love your perspective, asking yourself when it comes to diagnostic, is it worth it?
Yeah.
And it seems to me like that is very much a philosophy that's probably born out of the emergency background, right? Like how often as an emergency veterinarian are you there and you've got sort of limited funds or budgets and you're saying, what are we doing here, guys? Yeah, all the time. What are we doing here, guys? I've been a big fan of the spectrum of care movement in veterinary medicine. When we start to look and we start to say, look, how do we meet pet owners where they are? How do we make sure that people are getting care and not feeling guilty and working with what we have to try to provide not just a ladder where there is a better, best, even better, but more of a there's a lot of different ways to approach this.
For sure.
When you look at it from a diagnostic standpoint, how do you look at spectrum of care, Jimmy? Like, how does that fit with the suite of diagnostics you have?
You shouldn't run a test if you don't know what you're going to do with that information, I guess is the point. There are so many available options at the moment being just really crystal clear about what question you're trying to ask, I think is one of the biggest sort of things that my first sort of piece of advice, learning this from a bunch of years of practice. You don't know what question you're asking in that moment. It's difficult to kind of know how to make heads or tails of that information, honestly. And I love, just like you, that whole idea of spectrum of care, where we're partnering with our clients or partnering with the pet parents and trying to figure out what makes the most sense for your family. And I certainly don't want to advocate, using diagnostics in place of therapies, right? So sometimes the therapies are more important than the diagnostics in getting the right outcome in the case. And so that's sort of what I think spectrum of care is all about. I'm a huge fan of Jason Coe and all of his work in spectrum of care. And, one of the things that he talks about is the value matrix, right? So like, what are you, and part of that is like, what are your clients' goals? What are your goals? Like, what are you trying to sort of figure out? And then merging those two together as like kind of equally important pieces of information. And that kind of helps you make your decisions about what you're going to do. As veterinarians, we have all kinds of different areas in which that we are, accountable to, are accountable to our patients. We're also accountable to public health. We're accountable to animal microbial stewardship. There's lots of things that that we have to think about whenever we're sort of making recommendations and guiding folks in sort of the right direction. And, from that perspective, spectrum of care, needs to be kind of part of your conversation, because like that information that, you bring to bear on a case is important in the context of the pet, the parent, what they can do, what they're going to be, what therapy they're going to need. The classic example I always think about in this way, taking x-rays on a dissonant cat. You kind of like, do you really want to do, you better really want to take those x-rays, right?
Yes.
So that information is going to, potentially be dangerous to the pet. You're going to spend some money. You're also going to, be delaying therapy in some of these circumstances. So is that piece of information that you're getting, like, is that really worth that? So if you are going to do it, you need to squeeze every ounce of data out of that radiograph as you can, right? That's why I advocate for things like AI-assisted radiograph interpretation. If you don't have a radiologist that could overread those, or, depending on kind of your scenario and situation, your comfort level with radiographs. So it's not just like the kind of the fancy PCRs that we're doing. We're talking about like squeezing every ounce of data out of the things that we normally do.
Yeah. Well, I love that example of sort of the AI radiograph interpretation, right? What I sort of hear from you, which I think is it's a beautiful message. You make it really simple. It's be intentional with your diagnostics.
For sure.
What are you trying to do? What are you trying to find out?
Yeah.
One of the things that I'm seeing in diagnostics today is real improvements in nice little helpful follow-up pieces of information, as far as, hey, based on this blood work, you might consider a couple of other things, and here's why. And so you're talking about sort of the radiograph interpretations and things like that. Mm-hmm. Talk to me a bit about how you see innovation around guiding either follow-up tests or sort of future diagnostics or things like that.
I mean, that to me is one of the most exciting parts about, artificial intelligence, in veterinary medicine. And medicine today, honestly, is sort of that, thinking about those differentials and next steps that kind of can help to jog your memory about it. And, I think of them as being almost like cognitive aids. And it's not that we don't know some of these things, but a lot of times it's just, it would never have occurred to us in these particular situations, right? I mean, you think about, the first few times you diagnosed an addisomia, it didn't come with a sign on it that said it had Addison's disease. You had to think about that, right? And think about the spectrum of disease, spectrum of diagnostics that you had that kind of give you that clue, right? So, and in retrospect, it totally makes sense, but at the time it doesn't really, right? And so that's the great thing about artificial intelligence, is that it allows us to be able to digest a ton of information that we'd never be able to do in that minute. And other things like with rapid read that I think is really fantastic is that it doesn't have cognitive biases like humans do, right?
Yes.
When you think about when you're reading radiographs, honestly, the phone's ringing, there's dogs barking in the background, somebody's asking you, do you want lights with this? You've got all these sort of inputs, and you're trying to focus in on the radiograph to sort of read that. And, they don't have that distractions that humans do. And when they identify in this particular, in our scenario, they create these bounding boxes around the pathology. It will draw a circle literally around the pulmonary edema that you see sort of in the radiographs. And that's, that's pretty nice because you can then say, oh yeah, that does look like pulmonary edema. Boy, that changes my sort of thought process a little bit. And which is really good when you've got a ton of other things going on. I think we're going to get to a spot where, all of our diagnostics are going to kind of be in one spot, and there's going to be some digestion of that's going to lead us in different directions, but it's not going to be able to do a chest tap or drain an oral hematoma, right? So for those kinds of things, and we have to use them for how they were intended to be used, not to replace veterinarians, but to improve how we practice and improve the quality of the decisions that we make, which I think is really going to be the exciting part, and how that kind of gets melded together going forward. I think it's going to be beautiful.
Yeah. Well, two things that come out of that in my mind, I call it the shoot. Like I have been a victim of, the pet owners come in and they have a very strong opinion about what is going on, and they sort of lean into it. And you have other things that are sort of going on that kind of walk you in this direction. And it's always dangerous when you, start intentionally pursuing a path that maybe there's other paths we should have looked at a little bit more before we just really went down this one. And so I think the idea of the differentials is really great. The other thing I would say, I think that there's good ways to use AI and bad ways. And I think probably the best way is AI is a fantastic teacher, like the ability to learn and say, oh, okay, I ran this through, it's just, I don't know, just for anything you're doing from software packages to medicine, if you run it through, and it's not giving you orders you have to follow, but just to wait and to sort of wait in and say, why is this coming up? Why is this the differential? And it's such an opportunity to continue to get better and better.
Yeah, big time. I mean, it's a tool for us, Andy. I mean, it's a thing for us to use, and we're still responsible for making the decisions as veterinarians. I mean, that's the reality. And so we have to use it in context of how it makes sense for our patients and how that works. It's funny you say we kind of get blinders on when we're, the owners think about these things. I can remember a case that I saw one Saturday afternoon when I was really early in my career, and I was the one working Saturdays, and it was just a UTI. And I was like, oh, okay, I'll see that. That's no problem. It was one of the worst intravascular IMHAs I've ever seen. It was like the UTI was what the owner thought was blood in the urine, was severe hemoglobinuria. And I just, that kind of thing, just really, you have to keep an open mind, or else you're going to get led astray.
You mentioned, in the future, having sort of diagnostics kind of all in one place and sort of interfaces coming out of that. Jimmy, what do you think diagnostics are going to be in 5 years? I know I'm not sort of asking you to look in your crystal ball, but sort of paint me, what is sort of the best case, what is the picture? How would diagnostics in general practice going to look different in, say, 5, maybe a little beyond that, years from now?
I don't know. I mean, it's really hard to prognosticate if some of the things, I mean, if you look at, there are a ton of, really advanced diagnostics that are becoming really small, less expensive, that can actually move into the hospitals where, we hadn't really thought about different things. I mean, there's a ton of molecular diagnostic things that are happening in really small packages these days. That are, I think that, it's going to be hard. It's going to have to prove clinical utility, right? So there's going to have to be ways in which we make sure that adds value in a short period of time. So that's a thing I think I would, keep an eye on, molecular diagnostics like PCR, even some, antibody-based tests are going to just continue to sort of become more and more flexible and allow us to be able to get information sort of in the practices. I think that's interesting. There are innovations that are out there that would blow your mind about what are sort of being evaluated. But one thing I can be sure about is that the integration of this information together of, kind of routine stuff, and the integration of that together is going to give us insights that we probably haven't ever really had, in the past. And so meaning that, predictive diagnostics are going to be really important. And that's taking, oftentimes it's being able to put in context over, with large data sets in order to be able to, kind of determine okay, well, pet with a phosphorus that's gone up, 0.5 in the last year, that's something that we would have to pay attention to. And so, we're going to get to a spot, I believe, truthfully, it's almost like individualized medicine. When we start integrating in things like genetics, along with our sort of normal lab work, radiograph findings and then digesting that data together. That is going to be, we're going to see that kind of thing take off.
That's amazing. Yeah, that gets me really excited. It totally makes sense too. It's sort of a new way to look at it. I want to switch gears a little bit here, but you were sort of talking about looking at sort of what people are doing and what's moving into the practice and things like that. When you came in as the chief medical officer and you're coming from Blue Pearl and you're coming in and you're looking at the diagnostic tests that are getting done at Antech.
Yeah.
Were there any that you were surprised at how frequently they were being used, or any that you were really surprised that they were not being used nearly as frequently as you thought? And what I'm doing here is I'm sort of digging into practice a little bit of are people practicing in the way you expect, or were you sort of surprised to see behind the curtain?
Well, all right. So here's something that surprised me, but also didn't surprise me, if I'm honest with myself. I am still surprised a bit at how frequently people are doing fecal flotations in-house. All right.
Yeah.
And the reason why I say that is because, fecal float's oftentimes like, that's not an emergency diagnostic. Like that's something that you probably can wait a few days to do. I'm remembering my times in practice, it's always like in the lab, where there's the microscope and sitting there and there's, little tubes with glass slides like on top of them. They're just kind of sitting out there with their feces, and somebody comes and knocks them over, and it's always in a kind of a mess. There's technician time that has to do that. And if you think about fecal flotation technology, like that is a really old test. I mean, literally 100 years old, in like the technology and being able to use it. I'm surprised that we're still doing a ton of those in-house, because doing a centrifugation with that increases the yield pretty significantly. Like it's we kind of know that. And then even then, using PCR, for instance, in detecting, intestinal parasites is even more accurate than that. So you've got these sort of layers of accuracy that you sort of do. And PCR also allows you to be able to, see other things like drug resistance genes, things like that in hookworms, for instance. So I just use that as an example, and in some of these circumstances, a lot of times in some of these puppy visits, you'll do a fecal and you're like, boy, I think he might have it. Let me just go ahead and give him some Panicure just in case, and like that kind of stuff where you're like, but should we be doing those things? I think some of that surprises me that we haven't progressed a ton like in that area, but also practically, thinking about kind of how practice functions and what the conversations are like with owners, things like that. I'm not necessarily surprised about that, because, veterinarians we're kind of averse to change. I'll be honest.
Yeah.
Like, I don't even like to order different things at the same restaurant, right? I'm a creature of habit. So I kind of understand how that goes. And so, that kind of thing, I think, does surprise me a bit. But 20 years from now, are we really going to have that bottle of crusty looking, your solution salt, whether you're using a sugar solution or zinc sulfate or whatever, are we going to have that in our hospitals? I mean, probably not, probably not. We're probably going to be moving to, PCRs that, cost a quarter, for us to do and give us more information, like that kind of stuff.
My last question for you, what do you know now as the chief medical officer at Antech that you wish you knew when you were a criticalist at Blue Pearl?
Well, almost none of that has to do with veterinary medicine. Most of that has to do with the gray hair I have on my head. But I think some of the best things that I've learned throughout my career, like no matter which setting I'm sort of talking about, I've listened. You ask a question, and then you listen. You don't listen to respond. You just kind of listen to kind of gain the information that they have, and just let people kind of share with you what's on their mind. It'll be amazing, like what you learn, whether that's like little insights into a case of, we were eating corn on the cob at the 4th of July party and now he's vomiting. Like, you know what I mean? Hearing those little pieces of information that really kind of steer you in the right direction, or, help you to understand, like, what is your technician motivated by? What do they want to do with their life? What do they want to learn? How do you engage them? How do you sort of improve their lives or the folks that are around you? That's one of the things that I think I'd probably do a little bit more, talk less and listen more.
That's fantastic. Jimmy, thank you so much for being here. Where can people find you online? Where can they kind of keep up with what you're doing?
Yeah, I'm on LinkedIn. So you want to, send me a request. Love to, interact in that way. I find it's really awesome to sort of share information, and, any questions about diagnostic tests and things like that, our website's pretty good. Got a lot of great information. So antechdiagnostics.com.
Sounds good. I'll put them both links to both in the show note. Thank you for being here, guys. Thanks for tuning in, everybody. Take care of yourselves. And that's what I got. Thanks for being here, guys. Thanks to Dr. Jimmy Barr for being here with me as a guest. Thanks to Antech Diagnostics for helping make this episode happen. Gang, take care of yourselves, everybody. Be well. I'll talk to you later on.